Hi, this week we are discussing the heart in AMP2, and this is a little mini lecture on cardiac output and stroke volume, preload and afterload. So, to begin with, the cardiac output is the amount of blood that is pumped by each ventricle of the heart. So, whether you're looking at the right ventricle or the left ventricle, either one, it's just the amount of blood that's pumped by a ventricle in 1 minute. And to determine cardiac output, you just need to know two things. You need to know the individual's heart rate and also the stroke volume. So, stroke volume is the amount of blood pumped by one ventricle during one heartbeat. So, it's the volume of blood each time a ventricle contracts and pumps, the amount of blood that is ejected by the ventricle. And typically, this number is around 70 milliliters. So, it's 70 milliliters of blood with every beat, with every contraction. So that's the stroke volume. The other thing that you'll need to know to figure out cardiac output is heart rate. And heart rate is the number of beats per minute. So it's the number of times that a ventricle contracts per minute. So you take those two numbers, heart rate and stroke volume, and multiply them together, and that will give you cardiac output. So I mentioned that an average stroke volume for somebody is, for an average size individual, is about 70 milliliters of blood. The average heart rate for somebody, average individual, is about 75 beats per minute. So if you multiply those two numbers together, you would get 5,250 milliliters per minute. If you convert that to liters, that's about a little over 5 liters, 5.25 liters per minute. So that is an average cardiac output. So if you think about that, 5 liters, that's 2.5 2-liter bottles of soda. If you think about it that way, that's a lot of blood being pumped in 1 minute. And that is just when you are at rest. So a lot of times you are not at rest. You are up and walking around or performing exercise, and that is going to make that number go higher. So there is a maximum cardiac output that your body can achieve. That is usually somewhere between like 5 and 7 times your normal cardiac output. So that difference between the resting cardiac output and maximum cardiac output is called cardiac reserve. Okay, so if we look a little bit more at stroke volume, so remember that's the amount of blood that is pumped with every heartbeat. That is roughly 70 milliliters of blood. So that amount isn't the entire amount of blood that is in a ventricle. The ventricles, when they contract and they eject blood, it's only about 60% of the blood that is in those ventricles that actually gets ejected. So not 100% of the blood that's in the ventricles gets ejected from those ventricles. They're not completely emptied. So like I said, only about 60% is ejected, and that ends up being roughly 70 milliliters. And there's two main factors that influence stroke volume, and those are preload and contractility of the heart. There is a third factor that may sometimes influence stroke volume, but usually this only has an influence in people that are not healthy, that have high blood pressure typically. So I'm going to focus really just on the first two, The first one is called preload. And preload is a measure of the degree of stretching on the heart wall. And the effect that stretch has on stroke volume is explained by a law called the Frank-Starling law of the heart. So that states that when there is a greater stretch on the heart wall, there is going to be a greater contraction. So think about what would cause greater stretching of the heart. That typically happens when there's more blood entering the heart. So if there's more blood filling a ventricle, then there's going to be more stretching of that ventricle. And as a result, that's going to lead to a stronger contraction, which makes sense because it's going to contract more strongly in order to eject that greater amount of blood that was causing that greater stretching. So when you have that stronger contraction, that's going to eject more blood from the heart. And that should make sense. That leads to a bigger stroke volume. So if there's greater stretching and there's a stronger contraction, that's going to lead to a higher or a bigger stroke volume. So it might be a number a little bit bigger than 70 if there's greater preload. So the other main factor that influences stroke volume is contractility. And that refers to the strength of contraction of the heart muscle and the muscle fibers of the heart. So typically, an increase in contractility is caused by a greater amount of calcium ions moving into cardiac muscle. So calcium is required for a muscle contraction. And in general, the more calcium you have, the stronger of a contraction you can have. So when there's increased contractility, there will be increased stroke volume. And just to explain one more term that is in your study outline, it's an inotropic agent. These are factors that affect contractility. So there's positive inotropic agents that increase contractility, and there are negative inotropic agents. Those are factors that would decrease contractility and cause a weaker contraction. So preload, which is stretching, and contractility, so how strong of a contraction you have, those are the two things that influence stroke volume the most. The third factor is called afterload. This is the pressure that must be reached in the ventricles in order to eject blood. So in healthy individuals, that pressure is pretty constant. It stays roughly the same, and it's not really a major factor in influencing stroke volume. However, in people that tend to have high, like chronic high blood pressure, the afterload is going to be higher. So the amount of pressure that the ventricles must achieve in order to contract is going to be higher. So for that reason, that actually reduces the heart's ability to eject blood. So that means that stroke volume will decrease. So if there is an increased afterload, meaning that the heart must achieve a greater pressure, which is difficult, then you'll have decreased stroke volume. All right, so I hope that helps explain cardiac output and stroke volume and some of the factors that help to regulate stroke volume.